And before we go, here's a recap of our top story. The region on high alert as person-to-person transmission of the Wuhan virus is confirmed and masses of people travel in China and overseas during the holiday season.
And in Singapore, National Center for Infectious Diseases will be the country's first line of defense, but it says the community must also play its part. Cheryl Go with more.
From pre-screening of patients to bringing them to designated zones such as this special precaution area, the National Center for Infectious Diseases, or NCID, has it all mapped out. Now, this may seem like an ordinary hospital ward, but it's really the negative pressure isolation room at the NCID. It allows air to flow in and out, but only through this exhaust here. Now, if Singapore were to have a confirmed case of the virus, this is where the patient will be held. As the virus is still very new, there is no specific medication yet, but the patient will receive all the necessary supportive treatment, such as oxygen therapy, to support the lungs. The Health Ministry has also widened the definition of suspect cases to include those with pneumonia and travel history to China within 2 weeks before symptoms start showing, or if they have acute respiratory infection and have been to any hospital in China, also within 2 weeks.
We cannot confidently rule out the possibility of receiving a case of this novel coronavirus. So the healthcare system is now being put on alert. For the general public, I think it is important for us to maintain good personal hygiene. We have received reports indicating that there are more male than female coming down with this novel coronavirus. And those older individuals as well as those with comorbidities tend to have more severe disease.
The NCID is also key in determining if a patient has the virus by looking for a specific pattern. The testing is done in-house under strict protocol to ensure staff are well protected.
We share certain things which are common to other coronaviruses like the SARS coronavirus, the MERS coronavirus from the Middle East, and actually even from our normal common colds. So we must be able to find that part of the virus which is unique to the new coronavirus, and then we design our tests to target only that.
At the ground level, community doctors are also on the alert, especially since patients would usually seek help from them first. One GP says travel history and symptoms such as fever are key telltale signs of a suspect case.
If it's stable enough, then a dedicated ambulance will be called upon to divert these patients to the relevant hospital. If the patient is unstable, means in a very severe respiratory distress, then the SCDF 995 will be activated.
Dr. Chung says the necessary personal protective equipment for clinic staff, such as gowns and N95 masks, will also be used in the event of a local infection.
And Singapore has seen some suspected cases of the novel coronavirus to date, but all have turned out to be negative.